House Haven is a credentialed mental health and peer support worker-led clinic to help people with long-term mental illness and difficulties.
I love that it's kind of a natural de-escalation place. Like, people come in here and they can be stressed, they can be depressed, they can be really, really anxious or upset, but just being here, they kind of let out a sigh of relief.
It is a beautiful place, isn't it?
Yeah, it is. Yeah. It's calming, and you don't really get that in clinics.
Our House Haven started with a vision that we had and shared about how we could really put good supports in place for people who felt unsupported by the services that were already available.
So my history, I've struggled a lot with mental illness over the years. Since high school, basically, I was in and out of hospital for suicidal and self-harm and eating disorder and all sorts of other issues. So I spent a lot of time in and out of hospital and never really got anywhere. It was just one hospital to the next and nothing actually recovery focused. And I was getting worse and worse and worse until I was about 24, and that's when I met Carrie at Headspace, and that was sort of the start for me of being listened to as a person and just allowing an entire new concept of recovery for me that I didn't think was possible.
And so we spent quite a lot of time saying, well, if we could make a perfect service, what would it be? And these discussions went on for quite a long time, didn't they?
They did, yes.
And then we realised that we both wanted exactly the same things. And what we wanted was that big space and calm and animals and peaceful and places where you could be heard and places where you could have your say and not be forced into doing anything that you didn't want to do. And of course, when people are in the middle of some traumatic experience, the last thing they want to do is talk. So being able to say, let's go and grab a carrot out of the fridge and go and see the ponies and walk downstairs and do exactly that takes a whole lot of pressure off immediately.
I have been out of hospital for about 8 years now, I think. I haven't self-harmed in just as long. When I used to self-harm every day, like multiple times every day. And now
I love what I do. It's been such a gift after all of those years of working in hospitals.
I'm a peer support worker, so I walk alongside people who are struggling, and I use my own lived experience to support them in whatever way they need it. Sometimes that's just to sit with them while they're crying. Sometimes that's to actually share some of my own stories. And sometimes that's not. Sometimes that's not appropriate, and that's okay. If people come in here and they don't want to talk, we don't have to talk. We can do some art. We can hang out with the ponies. We can do whatever.
Well, anybody can come here. If they feel that this is somewhere that we can help them, they're welcome to come here.